NeoSED is an undergraduate biomedical engineering design team at Johns Hopkins University working to achieve early risk assessment of neonatal sepsis. Every year, 4 million babies die in their first 4 weeks of life, predominantly in low and middle income countries. Of these deaths, over 1 million are due to sepsis. Sepsis is the whole body inflammatory response to infection. The rapid progression of the condition makes early detection especially crucial in saving the lives of newborns. Neonates in developing countries are currently only brought to hospitals once they are already in the late stages of sepsis. This is largely because community healthcare workers, or CHWs, as well as parents, are only aware that their neonates are ill upon the onset of severe, life-threatening septic symptoms. Unfortunately, at that stage, conventional medical interventions are of limited effectiveness. Studies have shown that each hour of delay in treatment increases risk of death twofold. We propose a sepsis detection system which uses heart rate characteristic data and patient history information to produce a sepsis risk evaluation score. This early risk assessment will drastically reduce sepsis-related neonatal mortality by providing critical earlier treatment. We envision CHWs inputting maternal and patient history information into the family's mobile phone and loaning our SEPSOC device to families for the first 7 most vulnerable days following the neonate's birth. Our SEPSOC heart rate sensor will then collect and process heart rate waveform data. This data will be transferred to a family's basic mobile phone via an audio jack and will then be sent from the phone to a local processing station. Here, the patient history information and heart rate waveform information will be analyzed together in the SEPSCORE algorithm to determine the probability that a neonate will develop sepsis. If at risk, text alerts will be sent to the family members and CHWs, prompting them to seek treatment before the onset of severe, life-threatening symptoms. The cost per use of SEPSOC is very low, as both the hardware and sensor components are reusable. NeoSED will be easily integratable into the populations we seek to serve. Basic mobile phones are commonplace among both the families and CHWs. Also, our SEPSOC device will be culturally acceptable. The World Health Organization already recommends that newborns wear socks following birth to prevent hypothermia. Further, based on our interviews with experts in neonatal care, an integrated system such as NeoSED would be beneficial towards the healthcare systems of developing countries and even developed countries. So far, we have received promising results after testing our SEPSCORE machine learning algorithm using the MIMIC2 database. We are currently in the process of obtaining more neonatal data that can be used to further test our algorithm. Concurrently, we plan to conduct a field test for our physical device in a non-controlled setting. Specifically, we will collaborate with the Hopkins Masters team throughout their trip to Bangladesh this spring. Field testing may produce metrics to measure the success of the NeoSED system, such as the accuracy and rapidness of identifying sepsis, and to what degree our device is helping in reducing neonatal sepsis mortality when compared to traditional methods. We have identified 3 main phases of investment. Winning the $10,000 prize would help our team move past the first and second phases of product finalization and field testing, respectively. It would expedite the final prototyping and testing phases, enabling us to create a cheaper, more compact, and mass-producible device that is ready for deployment into our target countries. We would also be able to test the scalability and efficacy of our device in field settings, allowing us to improve upon our prototype based on feedback from these field tests. Further investment from non-government organizations would finish the second phase and support the proliferation of our device. Our team is the first team to address early risk assessment of neonatal sepsis in home-based settings. The existing alternatives are not applicable to low-resource settings, as they require either lab tests or precise, sometimes invasive monitoring methods that are only available in hospitals or healthcare facilities. The lack of competition in the neonatal healthcare field in developing countries presents us with a valuable opportunity to improve the lives of neonates. Our team is supported by a vast network of experts who lend their invaluable expertise. They range from public health experts to neonatologists. Further, our interdisciplinary team members have the essential skills in electronics, machine-based learning, physiological approaches, marketing, and entrepreneurship. With our drive in innovation, our team is confident that NeoSED can bring about a revolutionary change in standards of home-based neonatal care.